Is your question? Uh, One second. Okay, now, if you have read and understood, considering it critical care scenario, please tell me how would you manage this patient?
I will manage the patient according to ATLS protocol.
Right?
Uh, I will go for ABCD approach. Firstly, I will go for cervical neck cervical immobilization by sandbags and tape or hard neck collar. Then
Yes.
I will assess airway by talking to the patient. If patient is talking, airways okay. If there is any abnormal sounds or patient is not talking, I should go for further investigation or further examining of the airway. If there is any body foreign body in the mouth, I should remove it with Magir forceps. If there is any facial trauma, I will consider airway insecurity. I will give patient airway. I will both give the patient nasopharyngeal airway or oropharyngeal airway according his condition. Then I will aspirate any secretions from the airway to clear the airway. Also, I will consider if there is any obstruction of the airway and couldn't manage the airway, I will go for cricothyroidotomy or tracheostomy and then
Okay.
tracheal intubation.
What measures would you take for breathing?
Measures for breathing.
Yes, please.
I will go for to assess breathing by seeing patient airway respiratory rate and chest expansion, and there is any obvious chest wounds or lacerations.
Patient
Uh,
has multiple rib fractures,
yes.
right? And patient is complaining, right? So how would you go about and manage that?
Up till now, according to multiple fractures in the B approach, I will stick to the emergency or the critical interventions in the first 10 minutes, first 10 seconds, to ensure that patient is respiration is regular and nothing is endangering the respiration of the patient. I will give the patient a high flow oxygen mask, and if there is any obvious wound in the chest or there is open wound, I will cover it with three-side adhesive dressing.
Right.
Also, okay, this
Okay.
is regarding respiration.
Right. Now, considering the scenario, please tell me how would you assess the level of shock which patient has suffered?
Level of shock is assessed by seeing patient heart rate and patient heart rate, blood pressure, and his respiration, urine output. Also, his conscious level.
And blood loss. Can,
And
can you
okay,
calculate?
regarding
Yes.
this, I will consider. I will assume the blood loss.
Yes. So, considering this scenario, how much blood patient has lost? So, what would be the level of shock? This was my which class?
Okay, I will return to the stem. Patient is
Okay, considering if you have to monitor the
He
response.
has
Yes.
unstable vitals, so he is in the third or fourth stage of shock.
Okay,
Okay.
right. Thank you. Please tell me, how would you monitor the response of the patient?
I will monitor the response of the patient regarding by heart rate, pulse, urine output, and level of consciousness also,
Yes, and capillary fill time as well.
and capillary fill time. It's okay.
Right. Okay. If because patient was already complaining about the severe pain in the neck, you asked for one imaging. Which,
Okay.
how would you describe what kind of image is this?
This lateral cervical spine X-ray.
Okay. And what do you see? If you can explain.
I can see here a cervical vertebral fracture or spinal fracture on one of cervical vertebrae. I think this is the C5 or 4.
5 or 6. Please tell me, how would you, what is Glasgow coma scale? Because here patient was little. Okay, please
Okay.
tell me, what is Glasgow coma scale?
Glasgow scale is a score a scoring for the conscious level of the patient according
Yes.
his eye opening and his response to vocal stimulus or his motor response regarding his motor response also.
Okay, considering the patient is having a lot of pain, how would you manage the pain of the patient?
You will manage the pain of the patient according to WHO pain step ladder.
Okay, what is it? Please tell us.
First we will start with mild painkillers like non-steroidals and paracetamol. Then we'll go for weak opioids like codeine or tramadol. Then we'll go for strong opioids like morphine.
Okay, right. All right. Okay, where do you think this patient should be managed?
Uh, First, this patient will be managed according to Atlas protocol in the ER. Then, if a patient is still unstable, according his multi-trauma, patient should be admitted in the ITU or high dependency unit.
Okay, what is the admission criteria into ITU?
Admission criteria, we can come back to it later.
Okay,
Okay.
right. How do you suggest that patient's clavicle should be taken care of?
Um, Patient clavicle could be managed conservatively
Yes.
with painkillers and could be managed also with traction.
Okay. All
Okay.
right. Right. How would you take care of patient's nutritional status?
Nutrition status of the patient will be managed according his general condition, conscious level, and his tolerate his able for oral toleration, and also if he is on mechanical ventilation. If patient is awake and he can tolerate feeding, it's okay. If not tolerating, we'll go for intrafeeding via nasogastric tube or nasogastric tube. If patient cannot tolerate oral feeding, we'll go for enteral feeding, parenteral feeding.
Yes. Please discuss the image that you're looking at in front of you. What are these arrows showing?
This is a AB chest radiograph showing
Yes.
a left side pneumothorax
Yes.
with rib fractures and also surgical emphysema.
All right. Okay. What else do you see? Or do you want to
I
comment
see
on
also, I think there is a tracheal,
deviation?
as I see, this is a tracheal deviation. And
Yes,
also on on the left lower part, there is an costophrenic recess also obliterated.
did. Yes, yes.
Yes,
Good. Thank you.
thank you.
Thank you.